First, wash your hands. Even though you got gloves on, always wash your hands or sanitize your hands. You can never be too safe. And when you're cannulating, you're dealing with needles and blood, you want to avoid infections. That's paramount. That's number one. Okay, safety first, sanitize first, health first. I'm about to show y'all how to cannulate. I'm only going to do one needle today just to show y'all, but let's get it. Make sure you got alcohol wipes. You know, I'm gonna be doing 2 spots, so normally I have 2 out. Sometimes you might need 2, 3, 4, 5, you know, but practice makes perfect. So first, again, you make sure you have your alcohol wipes. As you can see, I have my tapes already ready, and this is to, after I cannulate, to hold the needle in place. I got my 2 16-gauge needles. I have my heparin. I'm gonna show you how to put heparin in too after we get done. You gotta make sure you have your tourniquet, and you make sure you have your scissors to hold your tourniquet. Now, all this I'm gonna teach y'all, and I'm just gonna be doing it myself. So this is just how you do it by yourself. So first, you put the tourniquet on. You get your scissors ready. So you wanna let the tourniquet hang. And you wanna grab it up here. Get your scissors out like that, and you want to go ahead and get there. And you want to get in that sweet spot right before your cannulation area. You don't have to zoom in this area. Right before your cannulation area. So now that you have the tourniquet on with your scissors to hold the tourniquet in place, you want to touch for the thrill and the bruit. Just make sure everything is pumping the way that it should be. This is my line of access. This is my fistula line. These are my surgery scars, of course. Y'all gonna see them all the time. So you always wanna touch, you wanna feel, you wanna make sure you get that throb, that pulse. So this is where I stuck at last time. So I'm gonna go a little bit above that, and that's where we're gonna cannulate my first hole. We're gonna use 2 fingers, and then we're gonna cannulate the second hole. So I'm gonna do 1 here. So again, you feel for the vein itself. My area is this wide, and my vein is very shallow. So we're gonna go in about like a 20 to 35 degree angle. So what you wanna do is you wanna take your alcohol wipe, open it like so, get that out the way. Now when you find your spot, so right here, I'm gonna find my spot. I'm gonna go right in here. I can feel my pulse, it's very strong. And I can feel my line. My line goes up like this. It goes right over this eye, and it goes up, right over the R. I'm gonna wipe it with the alcohol wipe in circular motion. Gonna grab the syringe, 17 gauge. Make sure it's faced upwards. By the wing, you grab the cap, pull the cap. It's supposed to be in the trash can. But you see this little black dot right here? You want to make sure it's lined up with that wing. You have the black dot with the wing, and everything is lined up. So again, you go back over to your site. Again, you want to make sure that everything is lined up. See, this is my last area right here. You want to make sure that everything is lined up. So I'm going to feel for it again. Every time you touch this, you got to make sure you wipe it with alcohol again. So I touched it again, feel for it. Make sure I wipe with some alcohol for clean. Get it clean. Grab it by the wings. Good.
You're good.
Now for me, I use my middle finger as placement and to pull my skin down some. You always want to make sure your mat is under you. So I pick my spot, it's right in front of my last hole. You grab the 2 wings here like so. I use my middle finger to hold my skin down in about a 20 to 35 degree angle. You want to go ahead in and puncture your skin. I'm puncturing my skin, and I'm waiting for it to flash. It's still going in. Still going in. Still going in. Still going in. There it is. The flash is starting to come. Flash is still starting to come, yo. I got a little flash. That means I need to go in a little bit further. There you go. Now come back over to this side. I'm gonna lift my hand up, but I'm gonna keep pushing though because I have my flash. I have the flash, and this is what the flash looks like. So when y'all get the flash, y'all just want to flatten out and keep pushing. Keep pushing with the wings. 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 As you can see, this is my flash. This is my pulse here. Just like that. Keep pushing real quick. Okay. Now you tape wing by wing. So that's the first wing. As you can see, it's still flashing. Second side. And this is so that the needle doesn't move at all. One across. So you got your little helicopter propellers, the H's, one across, and then the last one is the bumper. And that goes where the needle is exposed. Once you're done doing that, you want to pull this just to make sure that it runs up. Twist it a little bit and stop it once you get to the top. Just like that. And that's how you cannulate. And I'm also going to show y'all how to put heparin. This will be the ulterior, and this will be the venous, the top part. You put the heparin in the venous, and I'll show y'all in a second. I'll probably speed up the next one. I'm going right after that, bro. Going right here. But I'm gonna speed this part up. Come on with the tape. Alright, now I'm gonna add heparin. Take this cap off here. Take the heparin cap off. This is heparin. Heparin. And when you putting in heparin, you always want to have it upright like this, unclamp. You always want to draw back to about 10, and then go all the way down to about 1. And if you cannulate it correctly, it should be smooth. So you do this 3 times. This is the second time. Third time. Clamp. And that's how you cannulate.